Right, so draws test. So obviously what we're trying to do is check what the anterior and posterior cruciate ligament's doing, whether there's damage to it. Now what shouldn't happen is, when I do a pull on this, it shouldn't pull the tibia forward. Alright, or it shouldn't allow it to push back, because that's going to indicate one of my cruciate ligaments is damaged. Alright, so all I'm going to do is I'm just going to come to the edge of the bed. I kind of just slightly pinned his ankle a little bit, and what I'm doing is I'm getting behind into the popliteal region and then coming where tibialis tuberosity is, coming around there, nice grip, and then from there I'm just easing forward, and if there was severe damage to the ligament, that's going to come really far forward and he's going to squeal.
The kneecap wouldn't?
No, the bone.
The bone would?
Yeah, the bone will come forward.
Right.
And likewise I push backwards, and like there shouldn't be any movement. The only movement I've got is I'm actually pulling his hip.
Yeah.
If the cruciate was damaged, that bone would all just come forward.
Right.
Yeah? So that's what we call a draws test. I'll show you the medial collateral stress test now. So from that one, just going to let the leg come down into that position. Just bear with me. That's it. And this time what we're going to do is we need to bend the leg the opposite way to each other. So all I'm going to do is put a block on this side of the leg, and I'm going to hold it on this side, and I'm going to hold that there, and I'm going to pull with this hand towards myself. And as I do that, if there's excessive movement, and again client will react if there's a medial collateral ligament damage as I do that, because this will all start to open up.
Right.
It'll cause severe pain. Likewise, I go the opposite way and turn like that. Do the same. Do the lateral side. That's your collateral ligament stress test. So draws test, then a stress test to look at all the ligaments. So next one we're going to look at then is that Aply Grind test. So it's a meniscus. So we've just done our draws test for anterior and posterior cruciates, no problem there. I've just done my medial and lateral collateral stress test, no problem there. So I've got to now be thinking, because my client's still saying he's got pain in the knee, so maybe it's a meniscus tear. So all I'm going to do now is bend the leg up into that position, so it's straight up and down, and from there what I'm going to do, coming on top, I'm going to apply downward pressure and at the same time put an internal rotation on. And if he's got a meniscus tear, that will hurt.
I can feel the pressure.
Yeah? Yeah. Okay. But you would have known if you'd got a meniscus tear.
Yeah.
So, okay, at this point I'm going to say, right, meniscus tear, I'm going to send you to doctor's hospital. Alright? If we really want to, we can establish is it a right meniscus tear or a left meniscus tear. So this time I'll roll you over. So this is what they call a McMurry's test.
You could feel like where it...
Yeah, grinded.
Yeah, you could feel where it was working at what.
Yeah. So now, McMurry's test, so what I'm going to do now is I'm going to bend the limb up. And what I want to do is get that joint line. So from there, get onto the joint line, so I go one side and then the other. And from that position with the knee bent, what I'm going to do now is, really crepitus in that knee. What I'm going to do now is kind of straighten it, but at the same time internally rotate. And I'm creating a biting force on the right side, but not the left. Yeah, so if it's a right meniscus tear, or medial, that's going to really hurt, because I'm internally rotating onto it.
Right.
If it doesn't, bend the leg back up, put the pressure more onto the lateral side, at the same time I'm going to externally rotate and take it down, and that cause a bite onto the meniscus on that side. So if it's the tears on that side, laterally, when I do it laterally way, it's going to hurt. So I know it's the lateral one. But reality is, once I've done a Aply Grind test, I'd be sending you off to the hospital.
Yeah.
Okay?
Yeah.
Right, so looking at range of motion now with the ankle. So we can imagine we've looked at gait assessment, looking at the height of the arches, looking at what the tendon's doing, because that's the giveaway, because it might be a natural height like I was just saying to you. But now we need to look at the range of motion related to the ankle now. So if we look to the gastrocnemius, so I could do this with him straight, so I've got a nice straight leg, but I need the joint straight. So this is generally why we'll lift it slightly. It doesn't have to be right high up, but from there. What I should be able to do is extend back and have a 90-degree angle. So if I kind of look to this leg on there, so if I raise that up and I do that, I should have a 90-degree angle at that point. And then likewise to do Soleus, all I'm going to do is bend the leg this time and should have the same range of motion. Again, I've actually probably got more than 90 on there, so his Soleus doesn't seem too bad. Maybe just tighter in the actual gastrocnemius.
Yeah, they will be a little bit.
Yeah. And that's range of motion on those two muscles.
Okay.